Hello, I'm Dr. John Schnackle, a veterinarian with Fort Dodge Animal Health. The video you are about to see was produced as an educational tool to help illustrate the importance of proper administration of animal health products on beef quality. Throughout this program, we will discuss beef quality assurance practices, or BQA for short, that will help reduce or eliminate avoidable injection site defects in beef. To effectively illustrate these points, this evaluation was conducted in a weaned calf suffering from chronic health issues, which were determined by a licensed veterinarian to be terminal. For demonstration purposes, a variety of common animal health products were injected 2 weeks prior to this animal being humanely euthanized. Dr. Jerry Woodruff, a Fort Dodge veterinarian, will be conducting this demonstration. Some basic BQA recommendations for injectable products are: 1. Give all injections in front of the shoulder where the less valuable cuts of meat are located. 2. Multiple injections should be given at least 4 inches apart. 3. The maximum volume at one site should be no more than 10 mL. Of course, a smaller dose for lighter animals. 4. Use the most carcass-friendly route of administration. If the product has an option of IM or sub-Q, the sub-Q route should be chosen. 5. Change needles often, after every 10 or 15 injections. Sooner if the needle becomes damaged or dull. Beef quality assurance guidelines recommend all injections be given in front of the shoulder in an area of the neck known as the injection triangle. This keeps injections out of the more valuable areas of the carcass. On this animal, the injection triangle has been outlined with masking tape. The upper boundary is below the nuchal ligament, which is 2 to 3 inches below the top line. The lower boundary of the triangle is above the cervical vertebrae. The leading slope of the shoulder is the posterior boundary. Again, BQA protocols recommend all injections be given in front of the shoulder in the injection triangle. The cervical vertebrae lie in the middle part of the neck. The 2 vertebrae shown here provide a perspective on how large vertebrae are and how much space they take in an animal's neck. Reflecting the skin off the neck shows the underlying muscles. The knives show the upper and lower boundaries of the injection triangle. The slope of the shoulder is the third boundary. This leaves a fairly limited area for injections. Dissecting the neck muscles, expose the nuchal ligament. This ligament lies at the top of the neck and helps support the animal's head. Cutting through the ligament illustrates that it is nearly devoid of blood supply. This is why the ligament should be avoided when giving injections, because the product may not be properly absorbed. Any irritation a product causes could adversely affect how the animal moves its head and neck. The vertebral column is in this area. The vertebrae take up a significant part of the neck and are as wide as a fist. There is very little muscle on the lateral side of the vertebrae, so giving an intramuscular injection into the vertebral muscles should be avoided. Again, the lower part of the injection triangle is formed by the cervical vertebrae. The upper part is the nuchal ligament, which lies 2 to 3 inches below the animal's top line, and the posterior boundary is in front of the shoulder. When administering multiple injections, they should be at least 4 inches apart and should be no more than 10 mL each. If the first injection was given in the front part of the injection triangle, it is important to give the second injection at least a hand's width from the first injection. This reduces the chance of the products interfering with each other and not working properly. Spacing products apart also reduces the potential for both products causing an increased reaction in the tissues. 2 weeks ago, 2 injections were given behind the elbow over the rib cage. The injection nearest the elbow was a 7-way Clostridium, often referred to as a blackleg. Right behind it, an injectable ivermectin dewormer was given. Both products should have been given subcutaneously and at least a hand's width apart. The products ended up in the muscle and were administered too close together. As the muscle is cut, we can feel that the injection was inadvertently administered IM instead of sub-Q. There is a pretty large area of scar tissue, about the entire width of a hand. Cutting through where the blackleg injection was given, a lesion that extends deep into the muscles over the rib cage can be seen. The muscles should have a red color. The injection lesion is an off-white, very firm, fibrous area. This is the body's reaction to the blackleg vaccine getting into the muscle. If part of the tissue is trimmed out, a very distinct scar tissue can be observed. It is very firm to the touch. If the vaccine had been given sub-Q, it may not have caused as severe of a reaction. When the tissue is turned over, the beginning of the second lesion can be seen. As the tissue is sliced, a very firm, fibrous lesion can be observed. No more than 10 mL of any product should be given at any one injection site. A smaller dose should be given to lighter calves. There are a couple of reasons for this recommendation. First, more than 10 mL may decrease product efficacy because of the potential for decreased absorption. Second, with more irritating products, tissue damage may be minimized by using less product. 2 weeks ago, 20 mL of long-acting tetracycline was injected into the round muscle of the hind leg. This is not only the wrong location to inject, it was at twice the recommended BQA volume of 10 mL per site. After reflecting the skin off the hind leg, the injected muscle will be sliced through. The injection was administered in the center of the round. Here, a fluorescent green appearing lesion can be seen. There is also a lesion on the surface of the muscle. This lesion could be due to leak back caused by giving too much drug at one site. When product is given in the round, lesions tend to extend up and down the muscle. Making several cuts adjacent to the injected muscle, the lesion is observed extending several inches below and above the injection site. The lesion is deep enough it might not have been discovered at the packing plant and likely would not have been found until later in the retail channel. Removal of a slice of muscle will allow the lesion to be examined more closely. Even if the lesion is removed, the muscle left would be less tender than if the injection would have been given properly. The injection should not have been given in the hind leg, and 20 mL was twice as much as the recommended amount at any one site. If the product being used is labeled for both IM or sub-Q administration, the sub-Q route is preferred. This reduces the chance of causing lesions in the muscle. Should some scar tissue persist after a sub-Q injection, it can be easily trimmed during hide removal. When administering a sub-Q injection, a 16 or 18 gauge 5/8 inch needle is the best choice. An 18 gauge needle should be used in a lighter muscled animal and a 16 gauge for a heavier muscled animal. In an animal like this one, a 16 gauge 5/8 inch B bevel needle would be a good choice. There are two methods to administer a sub-Q injection. One would be to go through the skin at an angle, pull the needle back out of the muscle, and give the injection. The second method to give a sub-Q injection is the tent method. The skin is pulled up and the injection is placed in the space that was created. For intramuscular injections, a 1-inch needle is indicated. Use an 18 gauge needle in lighter animals and a 16 gauge in heavier muscled animals. How far the needle goes through the skin is important. The cutaneous muscle tightly adheres to the skin. Even with a 5/8-inch needle, it is easy to get into this muscle by accident when giving a sub-Q injection. Intramuscular injections should go into the muscles which lie beneath the cutaneous muscle. 2 weeks prior to this demonstration, 2 sub-Q injections were given in the neck. One injection by the tent method, the other by angling the needle. The first area of reactivity observed is where an antibiotic was injected using the tent method. Scar tissue can be seen adhering to the skin and can also be observed on the surface of the cutaneous muscle. Even though an injection is given sub-Q in the injection triangle, lesions can occur. If this happens, the lesion is in a less valuable part of the carcass. The cutaneous muscle that lies under the skin is not the muscle where IM injection should be given. After the cutaneous muscle is reflected, a lesion is visible within it. An antibiotic was injected by the angle method, but the injection was not done correctly. Slicing through the cutaneous muscle shows this injection did not end up in the sub-Q space where it should have been. After the cutaneous muscle is reflected, the muscles in the neck where an IM injection should be given can be observed. There are several muscles in the neck. Some scar tissue and firmness is evident in one of these muscles. Most likely, this lesion is from an injection given to this animal several months ago. The last muscle of the neck is being reflected. The small size of these muscles illustrates the limited area for giving IM injections. The muscles are triangular in shape. They are thicker toward the shoulder and thinner toward the animal's head. Putting the muscles together show the limited area in which to give an IM injection. The lesion observed on the surface and in one of the muscles is off-white and firm. It is most likely from an injection given prior to the ones administered 2 weeks ago for this demonstration. An important structure in the neck in front of the shoulder is the prescapular lymph node. Lymph nodes are found throughout the body and are important for developing an immune response. If an animal comes into the chute too fast and hits the head gate hard enough, the lymph node can be bruised. Bruising the lymph node could compromise its ability to develop the expected immune response following vaccination. In this area over the ribs, sub-Q injections of 2 different Clostridial bacteriums were administered. The upper injection was a 2 ml dose and the lower injection was a 5 ml product. The 2 distinct lumps can be felt under the skin. The area where the 5 ml product was given is larger than the 2 ml injection site. When the skin is reflected off this area, a considerable amount of scar tissue is evident where the lower injection was given. As the skin is further reflected, the upper injection can be observed. Purulent material can be seen when the lesion is cut through. It is common to have irritation around clostridial injections. The 5 ml product is usually more irritating, as can be seen when the lower lesion is sliced through. There is a significant amount of necrotic tissue seen in the center of the lesion. Even the 2 ml Clostridial bacterium can cause a significant lesion. The upper injection did get into the muscle, even though an attempt was made to give the vaccine sub-Q. 2 weeks ago, 6 mLs of a non-steroidal anti-inflammatory drug were injected IM into the top butt. As the skin is reflected, an area where the injection was administered can be seen. Slicing through the top butt will reveal if a lesion was caused by the drug. As the muscle is reflected back, a pencil eraser-sized lesion can be observed. The darker rust-colored area is surrounded by white scar tissue. The lesion can be better visualized by removing a portion of the muscle. The lesion is contained in the top butt sirloin. Even though it is a small lesion, it is very hard and firm and lies in the middle of a valuable cut of meat. As discussed earlier, the tissue around the lesion may be less tender. Even if the lesion is cut out, the meat can have tenderness issues as much as 2 to 3 inches from the injection site. 2 weeks ago, 3 mLs of vitamin A, D, and E were injected IM in the right top butt. Being oil-based, vitamin A, D, and E can cause significant irritation. The injection site can be seen as a dark red area on the surface of the muscle. Underneath the blood splotch is where the injection was given. Cutting through the muscle will determine if any significant damage was caused. The injection is deep in the muscle. Trimming some of the muscle out makes it easier to observe where the vitamin A, D, and E was injected. The outer surface of the muscle is shown by the knife. The inner surface of the muscle, near where it attached to the hip bone, is where the lesion can be seen. The area being palpated with the thumbs is where the injection was given. Some firmness can be felt. The scar tissue seen formed as a result of the animal's reaction to the A, D, and E injection. The lesion isn't as severe as some of the others, but there is still a fair amount of scar tissue that developed. The fifth recommendation to reduce damage to the muscle is to change needles often. Only sharp needles should be used for giving an injection. Dull or worn needles cause more tissue damage going through the hide and muscle. Needles should be changed at least every time a syringe is refilled. If a needle becomes bent, never straighten it or continue to use it. A bent needle has been weakened and could break off in the animal. A broken needle left in the muscle can cause a significant product defect if not removed. Also, burred needles, such as the ones shown, should be replaced immediately. This video provides you much of the basic reasoning behind today's beef quality guidelines for utilizing injectable animal health products. In summary, these guidelines are: give all injections in front of the shoulder where less valuable cuts of meat are located. Multiple injections should be given at least 4 inches apart. The largest injection given should be 10 mLs, less in lighter animals. Use the most carcass-friendly route of administration. If the product has an option of IM or Sub-Q, the Sub-Q route should be chosen. Change needles often, after every 10 or 15 injections, sooner if the needle becomes damaged or dull. Beef quality assurance is the responsibility of every cattle producer and veterinarian. The proper administration of animal health products is only one component of a complete BQA program. Other components of the National Cattlemen's Beef Association BQA program include care and husbandry practices, feedstuffs and sources, feed additives and medication, processing and treatment records, injectable animal health products. By utilizing BQA practices in your business, you enhance animal welfare and contribute to our consumer satisfaction of beef. Following these guidelines should help keep injection site defects out of the beef supply. I'm Dr. John Schnackle with Fort Dodge Animal Health. I would like to thank Dr. Jerry Woodruff for conducting the demonstration and thank you for watching.